In Africa, 24 million people are living with HIV, causing an annual death toll of around 500,000. But these figures would be so much higher were it not for the introduction of anti-retroviral therapies a couple of decades ago. But as well as the lives that these drugs have saved, have they also been successful in reducing levels of conflict? Hello, Dominic.
Hi, Tim. Thanks a lot for having us.
Hello, Andrea.
Hello, Tim.
And welcome, Uwe, as well.
Hi, Tim.
Now, Uwe, I'll start with you. We can't discuss what happened with anti-retroviral therapies without, first of all, talking about the devastating death toll from HIV and AIDS in Africa. If we go back to 20 years ago when these therapies were introduced, at that time, how prevalent, how deadly was HIV in the region?
Yeah, it was a very deadly disease. So the estimates around the year 2000 of prevalence were about approximately 26 million infected people in Africa, and that made up for about 70% of all infections around the world. But there was a lot of heterogeneity, in fact, of the prevalence across Africa. So in some countries, the prevalence reached between 10 and 25% of the adult population. And since you asked about the fatality, so before the introduction and the dissemination of antiretrovirals in 2001, it was more a question of how fast infected individuals would die. And they would die within a few years, in fact. And that changed dramatically with the dissemination of ARTs.
Yeah, Dominic, looking back to that time, how severe was the economic and the social impact of this pandemic?
Well, 3 years ago, when we started this project, we would probably have had troubles to imagine how profoundly a society can be shaken by a major health emergency. Now, after our experience with COVID, we may have all of us a better sense of how profoundly the backbones of our society can be hit by major health disasters. And this is obviously the case for HIV, which was a major catastrophe. And, you had physical illness and grief, economic collapse, and also a lot of mounting social tensions that were striking at the beginning of the HIV pandemic in many countries. So it was a major, economic and social blow as well, in addition to the health situation.
Andrea, then, we have this terrible situation, but then finally some good news, and the antiretrovirals are made available. Strictly in health terms, how big was the impact of this?
The impact was huge, was very positive, and since 2001, when antiretrovirals price dropped dramatically, living condition of people living with HIV and AIDS improved a lot. And in particular, to give you some numbers, what we can see in the data is that the number of people, the number of HIV/AIDS related deaths was reduced by half in over 20 years. And also the number of new infections over in the last 20 years has decreased by 1/3.
So, Dominic, you wanted to investigate the impact of this health success on violence. Now, I can understand why ethnic tensions or competition for resources might cause violence, and if you reduce those, then you reduce violence. That's a lot of the work that you do. I don't understand necessarily why a health intervention might reduce violence.
Well, it's a very good question, right? And I think, the typical starting point of a cold-hearted economist would be to think in it in terms of productivity of work and of opportunity costs. So the idea would be, for most economists approaching this problem, would be, well, if you have a major health emergency, productivity goes down, and so kind of the opportunity cost of leaving productive activities for appropriation would also go down. So that would be kind of the standard reasoning that also tells you, in a country that is poorer, on average, it's easier to mount a rebel army than in a rich country, because salaries are lower to pay rebels in poor countries. Now, of course, here in this situation, we have from the beginning thought that, well, maybe we're dealing with another kind of situation where it may be more about trust as well. Because, of course, you know, the kind of ultimate failure of a government is in situation where they cannot protect their population against major crises. You have a major catastrophe hitting a society, and if the government doesn't show itself capable of helping its population, then that's kind of the ultimate failure of a government. It loses all credit. The social trust in the government is gone, and so that's typically kind of the mechanism that we had in mind from the beginning, that it may be about depletion of trust. And that's also what we then investigated in the paper and ultimately found in the data.
Yes, how did you investigate it, Uwe? Because you have to make a causal link from the anti-retroviral drugs being available to a reduction in violence. It strikes me it must be very difficult to sort that out from all the other influences, all the other causes of violence that there are in the community.
Well, our identification strategy basically exploits these unique natural experiments of the global expansion of anti-retroviral drugs for treatment that you mentioned. So what happened is that after the millennium, after 2001, the availability of generic drugs made treatment much, much cheaper by an order of magnitude at least, and that worldwide, which basically led to an explosion of treatment of HIV positives. Now, what we do to identify the effect on social violence is essentially combining this global trend, which is time variation, with differences in HIV prevalence across countries or subnational regions just before this expansion, which basically gives us the intensity of the treatment by country and over time in terms of the expansion of the ART availability due to the availability and the price decline of generic drugs. And using that, we have a setup that allows us to account for many other confounders, as you said, and other potential influences that vary over time within countries, but we are able to identify from this kind of setup what we want to identify.
What sort of conflict are you measuring, Andrea? Is it large scale, small scale? Is it in communities, between countries?
We are focusing on a small scale conflict, at least in terms of causalities and intensity. So we focus on social violence and unrest episodes, so events like protests, riots, and we focus on the African continent.
And Andrea, what was the impact then of anti-retroviral therapies on conflict?
Okay, what we find in our analysis is that the anti-retroviral expansion led to a reduction in social violence, and so both in African countries and in subnational regions. So we performed the analysis both at country level and subnational level. And we also try to study the effect on major conflict like civil conflicts, and we don't find any impact of these health policies on this big-scale conflict.
So, Uwe, this is a great result. It's very interesting, but does the data tell us anything about the mechanism by which these therapies are reducing violence?
Yeah, so this is always the hard question, and it's always hard to come up with direct evidence for the mechanism. Now, as Dominic said, there is quite a lot of motivation in terms of theory to identify opportunity cost channels and so on. We do in fact see potentially something there, but we don't actually find evidence that the generic economic well-being is a major driver in terms of opportunity cost. That might play a role, but it might not be the major driver. So we see a decline, as Andrea said, in spontaneous social violence and violence related to economic grievances. So that points at things at a lower level of aggregation and a lower level of social violence intensity. But most importantly, what we also see when we use survey data, that contemporaneously, the ART expansion led to a better perception of government policies that dealt with HIV. And that might have contributed also to greater trust of individuals, of respondents, households in institutions and in policymakers. And we see that, for instance, also in their subjective approval of policies in the context of HIV management, but also in the health sector in general and in economic terms in more general, not in terms of incomes necessarily, but in terms of how the government deals with the economy. And interestingly, we see also a greater trust in policymakers, in parliaments, but we do not see, for instance, effects in policies that are not directly related, for instance, like education policies. So that makes us relatively confident that what's happening here is a generic improvement in the trust in institutions that is helping to contain social violence.
Have we hit on something here, a way in which perhaps health interventions are undervalued because we think of them in terms of their direct impact on the health of the community, but this could be a way in which they have an indirect and very positive, very important impact. We've just been through another pandemic, and I'm sure it won't be the last. Dominic, should we be thinking that there is a higher value to these large-scale health interventions than is commonly assumed?
Yes, I completely agree with you, Tim. So I think there is a kind of double dividend of addressing the health problem and at the same time a wider peace-building effect. And I think what we've found in this study, in our view, is just the tip of the iceberg and maybe even the beginning of a research agenda more broadly on this topic. So we think that there is a considerable external validity of this result. So put differently, like key public policies like education, health provisions, they play a role in many countries and many situations around the world. And if you remember the speech of Abraham Lincoln and the shorter version in Bob Marley's song, you can fool some people sometimes, but you can't fool all the people all the time. That brings it kind of to the point, that nails it quite well. What it means is that if you show incompetence in handling a major pandemic, then it's like a bankruptcy of a regime. While if you can signal competency and that you empathy and that you care about people by handling a pandemic or a health emergency well, then in the long run, this should also help you get reduce social tensions and get political approval. And that's what we've seen after COVID, after the last waves of COVID, that politicians who have handled it poorly often have faced political troubles and are under pressure in their countries, while others who have maybe overall handled it better, they have rather done well politically since then. So I think it's something that surely deserves to be studied in much more depth.
As you say, there's a new research agenda. Well, fascinating research as always. Dominic, thank you very much.
Thanks a lot, Tim.
Andrea, thank you as well.
Thank you, Tim.
And Uwe.
Thanks a lot, Tim.
The discussion paper is called Medication Against Conflict, and the authors are Andrea Berlanda, Elena Esposito, Matteo Cevalati, Dominic Rona, and Uwe Sunde. It is discussion paper 17125 at CEPR. You can download it using the link that's on screen now. Also, don't forget the Research Policy Network at CEPR on preventing conflict that is run by Dominic. There is a lot of interesting research in that as well, so if you want to have a look at that, use this link. Well, that's all for now. We'll see you soon.